In this video clip, we ultimately want to show you one of our best cervical deep flexor strength building exercises to again enhance dynamic or muscular based stability in our patient's lower cervical spine. Before doing that, we want to make one quick point. Stabilization training for your patient with discogenic instability in their lower lumbar spine or discogenic instability in their lower cervical spine is not complete without teaching certain therapeutic activities and certain neuromuscular patterns of movement that enhance stability through facilitating the correct type of muscular contraction. So let's briefly go over a couple of important points. If we're going to have our patients really use their spinal extensors and spinal flexors, the ones that they've been training with our therapeutic exercises, we have to teach them certain simple things, such as we activate the thoracolumbar extensors by simply lifting the chest bone. We activate the deep cervical flexors by bringing the chin down and in. If your patients hold their chin and their breastbone close together, they will have dynamic muscular-based stability in their spine. After that, they need to move correctly. So with lifting the chest up, bringing the chin down, hip hinging, which facilitates lumbar multifidus contraction. Very important therapeutic motion that from a neuromuscular re-education perspective, our patients have to learn. Now, taking the chest up and chin down and in, extensor and flexor training, which you superimpose dynamically over various movement patterns, let's go into the supine head slide exercise, which facilitates both isotonic and isometric strength building for the deep cervical flexor muscles. Have your patients supported with whatever amount of pillowing they need to keep their lower cervical segments comfortable, and have them activate their deep cervical flexors by drawing their chin down and in toward the Adam's apple. Typically, we hold this position for 6 to 10 seconds, and then have the patient just barely move their chin up and away from the Adam's apple. Now all of the cervical flexors, both superficial and deep, are relaxed. And now slide the back of the head up the pillow, bringing the chin down and in to facilitate isometric strength building of the cervical flexors. This can be repeated a number of times in order to build strength in the cervical flexors. But remember, in order to enhance dynamic stability during common daily movement patterns, the chest needs to be up in order to facilitate extensor muscle contraction. The chin needs to be down and in and stay down and in during various lifting and other ADLs.